Hey, welcome back. This is Paramedic Project and thanks for joining us once again. Today, third episode on laryngoscopy, where we're finally going to talk about our own personal laryngoscopy position. We've talked about anatomy, we've talked about equipment, we've talked about practicing, we've talked about the patient's positioning, that in our environment they're pretty much always going to be on the floor or on the ground. So we all need our own personal laryngoscopy position that we can get into to get our head down low to the patient's level so that we can gain this view. Now, I think there's no absolute wrong or right position as long as it works for you. We're all anatomically different. I have long legs and a short torso, so my laryngoscopy position will be different to other people's who look different to me. Makes sense. So I'll show you my position. I'll show you a couple of variations. And it's up to you to go away, have a talk to some of your mentors, have a talk to some of your trainers and find out their positions they use, and maybe combine a couple of different positions until you find something that's comfortable for you, that you feel that you can work with. Big thing being it's comfortable, it's stable, and it gets your head down low so you can get that great view. So this is my position. I put my left knee near the patient's head. That allows me to brace my left elbow on my knee, and then I can insert the blade in the patient's mouth. My head's down nice and low, and I use my my right hand, my right thumb on the patient's forehead just to adjust the position of the patient's head. So that's my position. Other variations I know, some people will sit back on two knees and sit right back and get a view that way. Some people will lie down on their stomachs and prop their elbow on the floor next to the patient's head. So there's a lot of different positions out there, as I said. It's up to you to go away and practice, really come up with the position that works for you, commit to that position. Once again, like our other efforts in practice, where we're going to set up our equipment every time, start using your laryngoscopy position every time you practice the skill. That way, when it comes to doing it in real time, you'll be proficient, it'll flow well, and you'll be successful. That's been our final episode on laryngoscopy. Once again, thanks so much for your support and for joining us for the episodes. And find us on social media, and we'll see you next time.